Grampian we have a Green Theatre group which is aiming to implement the recommendations of the National Green Theatres project in Scotland. Most recently we've been working to reduce our nitrous oxide wastage, where we've been decommissioning the manifold nitrous oxide cylinder supplies that supplied nitrous oxide through pipelines to all theatre areas, and instead we're going to be using cylinders on the back of the anaesthetic machines. We expect this change will save around 1,000 tonnes of carbon dioxide equivalent emissions every year from reduced nitrous oxide wastage, and that's equivalent to driving over 7 million miles in a small petrol car. So the Green Theatres programme covers a variety of areas. Other examples include reducing the amount of landfill waste and increasing the amount of recycling that we do of non-clinical waste in theatres. And we're also looking at turning off theatre ventilation out of hours to reduce the electricity consumption. And there's other projects looking at reducing the amount of surgical fluid waste which goes for sterilisation, and instead discharging that into the grey water system. Yeah, there's lots of keen people throughout the hospital. The Green Theatre team has got people on it from all areas in healthcare, including nurses, doctors, healthcare support workers, operating department practitioners, the estates teams, and there's a lot of interest in sustainability, and we're quite excited about the work that we can do.
It's really important if we want to make sure that healthcare in the future is sustainable. So it's about the environment and making sure that we have got a planet for us, but it's also about our health and healthcare. So both of those things, they're inextricably linked. Think about the effects of weather, for example. We have lots of flooding, we've had lots of flooding. That can put an incredible strain on individuals and communities. It can affect their physical and mental health. If we think about heating up the earth, increased temperatures can have an effect on changing patterns of disease. We know a lot more about Lyme disease and how that's increasing as well. So there are direct effects to our health. They're not just affecting people in faraway countries, they're affecting here, us in Grampian, and the worry is, of course, if we don't do something about it, which we are doing, then the effects will become worse and harder to manage. Our staff are our stewards, and they want to be, so it's not something that we're encouraging them to do necessarily. They want to do it, and it's the reason why a lot of people want to work here, is because they feel passionate about the environment and about sustainability. Communities too, though. We've got ice crews, volunteer ice crews out there trying to cope with icy weather and preventing people at risk from slipping and falling. And that may seem like a faraway thing from doing what you can in a hospital, but everything that we can do to avoid the demand for healthcare is better for the individuals and is better for the environment.
We're committed to innovation, we're committed to quality improvement, all as part of our sustainability strategy. We know reaching the targets in this will be challenging, but we know we can make good progress if we work with partners across the piece and work with staff within NHS Grampian as well.